So much, doctor. So the next question, it reads out, my 12-year-old daughter has a painless swollen lump in her neck that hasn't gone away for weeks. She also has night sweats and has lost weight without trying. Could this be lymphoma, and what test should we ask for?
So again, this is a scary situation for any family or any parents to see this, especially if they Google this and then they'll find, oh, this could be lymphoma, and everybody's worried about what lymphoma is. So in a simple word for the audience, lymphoma is the cancer of lymph nodes. Lymph nodes are little glands which really is a cleaning site for our body. They clean the areas from the different parts of the body, and they are the little glands. If they house different kinds of blood cells, primarily B cells and the T cells. If these cells become cancerous and they grow out of proportion, this little tiny glands can become bigger, and that is what the families may be seeing is the uh, painless swelling of the thing. Most of the time cancers are not painful and they have painless swelling. In this particular case, they definitely need to get been seen by a doctor, at least get started with blood work, blood count, and metabolic panel, and might need to get like either an ultrasound of the lymph node to make sure how big the lymph node is and how it is looking. The ideal way of diagnosing or ruling out a lymphoma would be to remove the lymph node and looking at it under the microscope. You do by a biopsy. So that depends on how big the lymph node is, what are the other lab tests showing, and how the patient's exam is. If the lab work is showing any abnormality, or the lymph node is like 2 or 3 centimeter big and very fixed and hard, then it might be a good idea to remove the lymph node by a surgical procedure and then doing a biopsy and identifying whether this is a cancer or not, because it could really uh, either diagnose at an early stage in a good manner, in a timely manner, a lymphoma, which then is very curable cancer, so you could really cure it, or it might rule out a lymphoma and relieve a family from the stressors. There is a possibility sometimes a doctor might try a trial of antibiotics for a week or 2 weeks to see if the lymph nodes are going down, but it depends on the whole picture.